Good evening, everyone, and welcome to the Henry Schein Dental Academy webinar series. My name is Adam, and I'll be your moderator. We're excited to welcome back Dr. Alan Jurim as our speaker, as he will discuss the 3 beginner applications in 3D printing. Before we get started, we've got a couple reminders for you. At any point during the webinar, if you have questions, please feel free to type them into the Q&A section of your control panel, and we'll get to them live at the end. Henry Schein is not offering CE credit for viewing or attending this presentation, live or on demand, and this webinar is sponsored by Formless. Dr. Jurim, always great to have you back with us.
Wonderful. Thanks for the introduction, Adam. Hello, everybody, and welcome this evening. This lovely night, we're going to be talking about some of the beginner applications of 3D printing and how we can bring that into the practice. What are some of the benefits? And also, what are some of the tips and techniques that we can share from our experience in the practice, bringing these forth, using them productively, and hopefully it will make it an easier process for you to bring into your practice. My background in dentistry began with my sister. We have a practice together, and we grew up in the background of the dental laboratory field, where years ago we had a dental laboratory, German dental studio. And luckily, I was fortunate enough to have the experience of seeing some of the laboratory work as well as the clinical workflows, and also take our laboratory when it was primarily an analog laboratory and help bring it into the digital workflows. And a lot of that was adopting 3D printing and how we bring printing into the laboratory. And certainly today, I want to share with you how we were able to bring that into the practice, because I feel like as the technology has grown and been more developed, there's a lot of new workflows that really link you and your laboratory very well. So, part of the goal today is to really share. And as we develop these workflows and we bring printing into our practice, we really do it because we want to make the dentistry better. And hopefully that's what I'm going to be able to demonstrate tonight. As a lot of the workflows I'm going to share and some of the simple, tips and techniques are really evolved over many years of trying to, always make the process better in our practice. My background is in dentistry in the laboratory, but also in engineering. I was fortunate enough to go to RPI and earn a degree in computer systems engineering and electrical engineering. And from there, I went to NYU. And I don't ever think like I left my engineering background behind. I like to say that I speak fluently the language of technology and clinical dentistry in the laboratory and translate between them. And that's how we're able to put together a lot of these workflows. So, I never really left my engineering background behind. That was my desk in dental school. And, even during the pandemic, I've always enjoyed using some of the cool techniques. In fact, doing a face scan, trying to create a special face mask, and using the 3D printers that we have access to, I think has been some of the really, fulfilling stuff in dentistry. This was a face mask design that we were doing for the dental school where we needed to produce them. So we started printing some face shields and other parts. But digital dentistry is really exciting. Today, we're going to focus on digital dental models, surgical guides, and digital splints. And these are hands down the most productive and most used applications for the 3D printing in our practice. And individually, we'll go through these and we'll try to discuss some of the most important parts of the individual aspects. But overall, the big concept is the digital ecosystem. All of these digital tools that we have, how do we apply them into a new workflow that should really make the dentistry better? And when we say digital dentistry, I like to begin by trying to explain. You should really think of digital dentistry in 3 different key categories. I call it IPO dentistry now, or really thinking as an engineer, it's really inputting information, how we process that information, and then how do we share, how do we output that information? And those are the 3 main categories of digital dentistry that we can use on a daily basis. And you should really think about those categories into what you feel most comfortable, as you want to bring this into the practice. And so today, as we go through, we're going to try to break down a lot of the tools that we use into those categories, and also how you can jump in and out of a specific workflow, based off those 3 different criteria. How do we input data? How do we process data? And how do we output it? Well, here are most of the tools that we use on a daily basis. And out of all the different tools, the inputs are the ones that are going to allow us to digitize our patients. So we have an intraoral scanner. We use a 3-shape trios. We have intraoral photography. We have 3D X-rays. We have 2D X-rays. We have other types of scanners like a PIC scanner, a photogrammetry scanner. And all of these tools allow us to get the digital information onto the computer, into the computer, the data. They allow us to record the data. And next, we want to process that data, because really the idea of processing data is where the value comes from it. So we can use that data to do a design. We could design a crown. We could analyze data. We could take a scan from a patient 10 years ago, a scan from today, and compare them and use that to maybe help us diagnose. And 3Shape is probably one of the biggest partners that we use in this realm. 3Shape is a company that develops both software and hardware for a lot of the digital workflows. In fact, they have office workflow or software that dental offices use when you scan. They have laboratory software, and they go back and forth. Now, one of the real interesting things with our partner tonight, Formlabs, and how we do our digital workflows, what's really interesting is if we talk about how we design cases. Now, what we see on the screen here is a simple scan we took of our patient, and we want to print this model. Well, we would have to take that, we'd have to design what the actual model would be like. You see here, I'm actually setting a plane, I'm trimming the model. And this process used to be done in very specialized digital dental software. Now that's actually even built into the software that we use to do the printing, which is a great new feature brought to us by Formlabs. So we're going to talk a little bit more about this when we talk about models, but you see here that the ability to take an intraoral scan and almost send it directly to the printer is a really, really beneficial part to these workflows and simplifying the process of how we can actually produce a digital dental model. So when we talk about outputs, what we're really discussing are how do we take the information that we've now generated on a computer screen and how do we actually produce it in real time? And that traditionally was done through milling systems. In fact, here we have 4 different milling systems on the screen. And as time has come on with 3D printing and dentistry, printing is really beginning to surpass and overtake milling in some areas because of the predictability, because of the ease of printing and the flexibility that we just can't always achieve with just milling. And to give you a brief overview, milling is where we are going to take a solid block of material and keep cutting at it until we end up with what we want. And 3D printing, on the other hand, is a additive manufacturing process where we are going to create layer by layer images that then get stitched together and built into a 3D model. Another very important output that's always overlooked too is just a computer screen in itself. So the really important parts of digital dentistry is how we take all of those different parts, the inputs of the information, how do we acquire the data, how do we process it, and how do we output it, is really all of the major categories of digital dentistry. Now, what's so great about Formlabs, and my journey with Formlabs began in, I believe, is around 2015 or 2016, around that time, where we got our first Formlab printer in the dental laboratory. And one of the best parts about Formlabs that we've been really successful with is the fact that they provide a complete solution. And I've seen this firsthand where, unfortunately, there's some companies where they'll put together a printer and then you'll have to go download someone else's software to use it. And then you have to get materials from a different provider. And you're really trying to fill in all the dots in order to actually link a workflow for you to take a scan and be able to print a model of that, if that's what you're looking to do. So Formlabs creates a platform. And this is another important concept to understand when we talk about models, we talk about guides, and we talk about splints, is that all the different parts to producing this in-house or to be able to print and 3D manufacture this requires a linked platform with all the different aspects. For example, the printer is not just the printer is also the materials. The printing system, the platform, also involves the design, not the design software, but the software that's used in order to actually create your print file. So what we see on the screen here is where we've already generated 3D models, and now we are going to take those models, put them inside the print build tray, and then actually upload to printer, and it will send that job over to the printer. And also another really big part of the platform is what do we have to do once the prints are finished? So if you look on the left hand of the screen and you see the printer with the models that are hanging upside down from that build tray, once a print is complete, every material that you're going to print in is going to need to be post-processed. And what that really fundamentally means is, well, the material has to be further finished. So on the two images you see on the right, the first one on the left, which is the little black box with the silver in it, well, that is an alcohol bath. So the first thing that's going to happen is that material needs to be rinsed. So any excess resin gets removed. And after there is a systematic, automatic process of cleaning the part, then it goes into the curing box on the right, which is a light cure as well as a temperature oven that will then photopolymerize and complete the curing of the resin, and you achieve the fundamental results of that material. So this platform, I cannot stress how important it is to have a complete platform that's linked. And another benefit that I've recently realized that I like with the Formlabs system is the fact that all the materials that you may want are provided by Formlabs within that that platform. And also, the materials easily load into the printer. So you're almost never actually touching any resins. The resins that we 3D print with that additively build the model is not something that normally you like to actually touch. And so having all of these resins in a closed system that easily loads into the printer, and means you don't have to actually really get involved with actually touching a lot of the materials, I think is really beneficial. You don't have to pour material into a tray and then pour it back into a bottle. So here's Preform, and this is the software that comes with the printer that allows us to print like what you see here as a surgical guide. So once a design is complete, that design is then loaded into the printing software like you see here. And then that software will allow us to create the actual job that we are going to then send to the printer. So think of it as the facilitator to get it to the printer. And another really great feature of the Formlabs platform is the dashboard. And this is an online portal to your printer where we can go and we can see a history of the prints. We can see statistics on the results of how much material we're using, how many times we've used a certain tank with the printer, as well as to get live feedback as jobs are printing overnight. There's a lot of times we're making a patient's immediate screw-retained implant bridge overnight, and it's a wonderful way for us to check to see how the printer is working, that the job is complete, and we know when we come there in the morning, our job will be ready and complete. So here is where we print in my office, and you'll see two printers on the left-hand side. Actually, one of them in the middle is our older Form 2 printer. It's the previous version than the Form 3B that you see to the left of it. And the Form 3B is the latest and greatest for dental printing. It's incredibly robust. It's very, very high resolution. And again, it has a complete package for us to be able to print like the materials you see here. This is the materials that I normally have that I use. So we have denture-based material, we have dental surgical guide, we have dental LT clears, what we use for our splints. We have some more of my hobby materials. We have gray, draft, and flexible resins that we can print in. So I was creating that face mask. I was printing it in a draft material, a cheaper material, and trying it and seeing how it works. And we also have dental model material. One material you don't see there is the actual denture tooth material, and that's not there because it's actually loaded in the printer. So we do produce a lot of digital dentures as well. So let's talk a little bit more about digital dental models, guides, and then some of the digital splints. So digital dental models, again, very, very important, probably the most common indication that gets used with the printer, surgical guides, and here's what the splints look like. But also there's other indications, and we're not going to discuss them in great detail today, but the ability to produce implant models, the ability to produce digital wax-ups, digital dentures, screw-retained implant bridges, try-in bridges, provisional bridges, all of these different indications are really unique in the ability for us to try in restorations and also confirm that the digital information from our design is accurate before we go into a final restoration. So getting more into digital dental models, the first question I always pose is, do we really need printed models? When do we need printed models? A lot of times when we do cases, aesthetic cases like what we see here, so this is 6 anterior veneers we're doing for the young patient. The main reason why we will produce a model for a standard case like this is twofold. One is for a technician to be able to actually have a model where they can put a unit on where they're going to hand build porcelain up. And that's really, the model becomes a placeholder. It doesn't become anything more than a way of orienting the veneer relative to the other veneer so that they know how to build up the porcelain. What we don't use models for is actually to create or a situation where we want to check the accuracy of our fit, because fundamentally it doesn't really make much sense. And I hope to be able to share a little bit with you why that is. So another case like what we see here, where we're going to create veneers on a patient like this. This is the end result, but we generate models throughout the process of actually creating the smile. And what's interesting with this, for example, and this is a really good tip if you are working with a laboratory where you have tackled the input part of digital dentistry, you take digital scans, you send it to your laboratory, they print the models, they do the final output, and then they're sending you back the units to deliver. Well, the good tip is that if laboratories are doing that, if they print your models once after the designs have been complete, like what you see here, the models could be generated in a way where the tissue, which normally has to be ditched and dyed manually and reduced so that the unit will fit on a working cast, could be done digitally. And the benefit of that, and I call these optimized models, is that the technician knows that when they're going to be working afterwards, that unit's going to seat perfectly on the model. It's not going to impinge maybe an interproximal papilla tissue, which prints hard and then the unit doesn't seat. And now they build up the porcelain incorrectly and you end up with a variability somewhere and why final units don't fit well. So if you do this process already and you work with your laboratory, ask them if they create optimized models for you, because you will be receiving back units that fundamentally should be positioned better in the mouth. So a case like this, we then create the resulting veneers, and then that can be touched up on a cast where they can be cut back and added porcelain to. In fact, one of the things that I found interesting was that we had a lot of patients who would then look at their case on top of like what we see here, either a tan model. Sometimes we'd have models that would print in gray, and they would look at the final veneers and say, why do they look so dark, and get worried. And so with all the different resins we have, I decided to get creative and actually print a model where we printed the teeth layer in A2 resin that matched the base shade of the patient's stump shade. And then we printed the rest of the model in pink, so that when we presented it to the patient, we had a better time. We didn't have the patient saying, why do they look so dark? But fundamentally, we're going to use these models as a way for the technician to have a placeholder if they're going to build up porcelain. We also use models when it comes down to situations like this. This is why I love digital dentistry. This is actually a case that we scanned yesterday. We just milled the crown today in the office. We printed the model today in the office, and the patient's going to be receiving the crown early next week. So what we do in a case like this, and why we decided to print the model, is so that we can use it to help verify the seating of the crown, and we can also cement the restoration on top of it. Again, it's not necessary. In fact, this case, I printed a model because I wanted to demonstrate, if you see how the crown and the emergence profile of the crown to where the analog would fit in the model here, it's been virtually cut out so that crown will fully seat properly. It's a really nice optimized workflow. And so when you have these models that get generated, whether they're designed by you in your office or by your laboratory technician, you have a very easy way of producing this on site and using this to your benefit if you feel like the workflow can benefit from it. So we scan all of our patients every time. All of our new patients come in, they receive scans, and we've built a patient library from that. But fundamentally, as the patients come in, we use the scans in order to help diagnose and to try to tailor a treatment plan based off what the patient's expectations and goals are. This is a set of models that I printed, a couple weeks ago, used for a diagnostic consult with the patient. This is the same model, just printed several times. And what we use it for is a way to help educate the patient and to educate us. Now, what you see on the left is the preoperative model. What you see on the right is what we call our digital tooth setup model. And a digital tooth setup, the reason why I say digital tooth setup and not wax up, is because that's really what it is. We're designing a new digital smile, a new digital proposal, and then we can take that and print it. And then we can use that in order to, let's say, maybe create an appliance, create provisionals, or even just do a smile mock-up. And this is a really powerful part to the type of digital dentistry that we do, because whereas traditional wax-ups were done using more traditional techniques, digital tooth setups and digital wax-ups can really optimize the process of designing a smile, because we can almost design a smile in a patient's dental facial profile. So digital wax-ups are by far one of my favorite workflows and favorite tools that we have in digital dentistry. And one of the key things to know about Formlabs and the models that we generate, and it was really Formlabs that allowed us to begin creating digital wax-ups for clients of the laboratory as well as our patients around 2016, because we could print a model that had the fine detail necessary, and B, a model that had a smooth surface finish. All of our printers, most of our printers are giant $100,000 plus printers that we had before, Formlabs and the wonderful providers. We couldn't produce a model that had a very smooth surface finish easily, which meant that when we would go ahead and try to take a putty mold of it and use that to make provisionals, either intraorally or wherever, we would then record, the same rough texture into the provisionals. So this is a very common workflow for us to create a digital 2 setup, whether that's created by us in-house or that's created with a design team, on the other side of the world. It doesn't really matter. We're able to receive that information and we're able to then 3D print it in-house and go ahead and use the results of that digital 2 setup. And so this is kind of what the process will look like. We would take it, we can load that putty with some bisacral composite, and we can use that and transfer it to the mouth. We also can use it to make regular appliances. We can make a traditional suck down appliance. We can make sports guards. We can make mouth guards. We can also make different Essex appliances for patients' provisionals. And this is really a time saver and a money saver, because, if we could eliminate having to physically transport work in the mail, right? And we can also increase the speed that restorations can be manufactured because we don't have transit time, and also increase the level of communication. We tend to get better results in less time with lower costs. And that's really what brings all this home for me. It's not the fact that we can say that we like to do digital dentistry. It's really that we're doing better dentistry. We're doing it at a lower cost, and we're doing it with better results. So how do we then apply some of these parts? Well, this is the same patient. We could then do an intraoral mock-up, and we can use this as a tool and technique to explain to the patient what our goal is, to see if we can match what the patient's goals are. And that can be information that can hopefully be used to, persuade a patient to understand, the value behind the treatment we're recommending to them. Really fun, exciting stuff. Now, this is a key part. Whether you decide to do digital scanning, digital design, or digital manufacturing, right? Input, processor, output. This processing part, the part that involves design, does not mean that you need to become a designer. In fact, most of this can be done remotely. And this is what gets real exciting, because if you have the right team and you develop the right team, it doesn't matter. Distance doesn't become a factor within that anymore. So you can collaborate like we never have been able to before, because of some of the benefits that, remote processing and remote digital design affords to us. So let's look a little bit at another case and demonstrate a little bit more of why those digital 2 setups and the digital models we produce for them actually produce more predictable results for us. So a case like this, from where we start to where we finish, there's a couple different steps in between. And those steps with the digital 2 setups really make the dentistry better. So we go ahead, we have our intraoral scans, and we have the right photography that we've generated. And this is a case, again, now from about 5 years ago now. And this is fundamentally why it's better. We're able to do this digital 2 setup directly in the patient's dental facial profile. And we're able to use that to generate a very patient-specific 3D digital 2 setup that, again, can then be digitally produced. In fact, because this case was old, you can see that this is the printer that we had printed it on, the Form 2. Very reliable, very good printing system. And then it allowed us to go ahead and produce the digital model. We then made a suck down on top of that. And then we tried it in with the patient. And once we try it in, then what we do is we do the right photography so that we can analyze it. In fact, if you look at the patient's right canine, to me, it looked a little bit long. So I knew that was something which I was going to need to adjust. But it also explained to the patient what our vision was. And then the patient feels more confident. We know exactly what we're doing before we ever actually do it permanently. And it helps guide the process to end up with a better result, because now we're systematically recording the right information. We're transferring to the patient more accurately, and we're then also able to share that with the laboratory as well. For example, when the patient likes their provisionals and then those are digitally scanned, we will print a model of that, and then we will send it to the laboratory digitally. And we'll take a scan of it and we'll send it to the lab, and the laboratory can print it, and they can then use that as a reference as they're finishing the case. They're building a porcelain, so they can actually physically see what the patient has approved and what they're creating for us. Again, another good technique in order to just improve the quality that and predictability we're bringing back to the patients. So this was also one of the first cases where we printed our first digital night guard, a digital bite splint. And, I was Pankey trained when it comes to, producing bite splints. I was making them by hand for years before we began producing them digitally. Once we were able to produce them digitally, we began manufacturing them with a milling machine first. And then we were fortunate enough to have the development of the materials that meant that we can then 3D print them. And I'll tell you now, digitally printed bite splints and night guards is probably the most common thing that we are printing in the office. I should say the most frequent. And that's because a lot of patients benefit from the digital workflow, from digital bite splints, and we benefit from the digital workflow for being able to produce them in-house, because we're able to bring the cost down. We're also able to produce them quicker, as well as when the patients, and if the patients ever have an issue with them, their dog ate it, which I always tell them be careful with, because dogs love them. They leave them in a hospital. It's easy for us to reproduce. And all of the bite splints that we produce, and we'll talk about this a little bit more when we get into bite splints, we keep a digital library of them so that we can always refer back to that digital information. In fact, this was one of those first cases, and I look back and I'm learning here. This was an older design. Now we're able to design ramps in it, and we're able to identify and adjust, occlusion better. And also we have more predictable fit. If I'm looking back at these images now and I'm saying, look, I don't really think that was fitting as good as it should. But this is always how I learn. I learn by looking at the photos afterwards, and I learn by studying. And the good news now is the development of the materials for digital splints and just how well it's become with the overall parameters and the fit is by far one of the most satisfying parts of our digital printing. So going back to the digital 2 setup again, as we are designing a patient's smile directly in their dental facial profile, like what you see here, the benefit is that we can produce something more customized for the patient directly. We can produce it inexpensively in-house. We can make modifications to it and reproduce it if we need to. But the fact that we can digitally produce it brings a lot of other benefits along with what you see here, the digital design and processing. See, if I want to change anything or visualize it, we have a lot of control. And then again, that could be printed. It could easily be transferred to the patient's mouth. And it's a very good way for us to infer the plan to the patient without doing anything permanent for that patient yet. Very exciting stuff when it comes down to digital tooth setups. And that's primarily how we use digital dental models. For cases where we're going to do porcelain buildups, for certain implant cases, or if we have other cases like digital tooth setups where we're going to be producing appliances. So let's talk a little bit about surgical guides now. And surgical guides are definitely the area where there was the most interest as to why 3D printing became so popular in dentistry before a lot of the other industries. And I believe that surgical guides truly really improve the process of how we're able to provide implant care for our patients, not just again, because we're able to make it more profitable, but really we're able to make it more predictable while making it safer for the patients as well. And when we then adapted our workflows to use surgical guides and planning into creating pre-prosthetics, that was another really beneficial part. So I'm going to share a little bit of that now. And fundamentally, surgical guides And the process of creating a surgical guide begins with aligning these two data sets, which is a surface scan of the patient's jaw and the 3D bone information. And so a patient like this, who's going to have a single tooth implant, for a retained primary tooth, can have a plan that gets put forth, and then we can easily produce a design for a surgical guide. So remember, IPO dentistry, in this stage, we're talking about inputting. So we've already recorded the patient's trio scans, and we've already recorded the patient's 3D bone data. And then we're going to process. So we're going to do a design, which is basically means we're going to align all the different data, virtually plan our implant, and then produce what we see here, which is the 3D design for our surgical guide. And this design of our surgical guide also allows us to have some other benefits, like we can produce an immediate restoration before the implant's placed, after the implant's placed, but it allows us to understand the complexity of the surgery and then to transfer that from the screen back into the patient's jaw. So in a case like this, you see where we had an immediate provisional that was manufactured through the case planning selection. And this is why I love guided surgery so much, is if we have the right type of case, when it comes down to doing the final restoration. So this is when we had removed the provisional for the patient approximately, I believe it was around 5 months later. And we're now ready to do the final restoration. Because the case was planned digitally, because the surgical guide was produced in-house immediately, and the surgeon was able to then place the implant in the ideal surgical and restorative position, and we were able to understand the complexity of the case and the likelihood that we would have good primary stability, we're able to change our workflow and do what we see here, which is create an immediate provisional and now create the final restoration. And look, when we create the final restoration, how we've already done one of the most important parts, which is restore the gingiva before we actually restore the tooth. So the gingiva has been formed nicely, and all of this comes back to our ability to be able to produce that surgical guide, to transfer all the information from our digital planning back into the actual patient's jawbone. So we had our final scans here, and then we go ahead and we produce the final restoration. And a lot of our single unit implant cases become much more predictable because we're able to incorporate this into that whole, workup and planning aspect of a patient's treatment. Case like this, where a patient needed an implant in the site of number 8 due to an old traumatic injury, and doing proper analysis of the smile and looking at certain measurements and saying, look at the width of number 8 versus number 9. Well, if we're going to do an immediate implant and a guided surgery for number 8, well, maybe we should consider digitally waxing up number 9 to match the width of number 8. And what you see in purple here is even the patient's 3D bone data from the cone beam scan can be used in the design of this provisional before the time of surgery. So this is being produced before the time of surgery in conjunction with the surgical guide. So we have all these great different parts. And I don't want to get too much into, all these different parts, but all of this happens as a result of our ability to 3D print effectively in the office. So it doesn't matter if you're talking about creating a single unit implant guide versus creating one for multiple units. The process of printing the surgical guide in the office and the process of producing that to have the benefits for the surgery are maintained with a system that allows it to happen effectively between the material, between the software, and the actual 3D printer itself. So what we see here is the finalization of the planning all before the time of surgery, so that at the time of surgery, we can use a 3D wax up to increase the width of number 9. We can create a provisional restoration for number 8 and transfer that to the mouth with what you see here, which is the surgical guide. So this is the surgical guide that we use for the case. We try to design our guide so that there's the maximum amount of irrigation available. And it's hard to see in this image, and you might think that it's weak, but the guide actually rests on the mesial of number 7 and the mesial of number 9 as well here to get positioned and well supported. And it allows for the maximum irrigation to travel. So once the design is done, and this process that you see in preform here, how we actually are now going to print the guide, happens with our team, with our assistant team, And it's very, very predictable. It's very easy. The software is easy to manage. It's easy for someone to pick up, to see it done once or twice, and then they're off and they're running and they're able to do it themselves very quick. So we have the design. We then add these little sprues, like what you see there. So it's a little platform for it. And then this will then get produced. Once it's produced, there is a small sleeve that we will put in it that corresponds to the manufacturing system. In this case, it was a BioHorizon system. And that allows us then to go right into surgery. Not that we do it usually the same day, but it allows us to produce it in-house very, very quick and effectively. And then this is the patient at their post-op visit, approximately, I forget, a week or two later. So really good results. And the ability for all this to tie together happens with you being able to print the guide, whether it's in-house or you're going to have your laboratory team print it. The guide really allows for the workflows to be improved. So last part we're going to discuss is about digital splints. And what's interesting about splints is that the process of producing the design for the splints has tremendously improved over time. In fact, now what we use in our office is a software made by 3Shape called Splint Studio. And 3D splints are really good because the fit of how the splint is in the mouth can be easily adapted to base off your philosophy if you want to have more retention or less retention. But also with the virtual articulation, we're able to try to reinstate some protective elements that the patient may have lost over time. And so digital splints really become effective in treating not just patients who maybe they don't have any, pathology of the joint, but to prevent that from future forming, as well as to treat patients with bite splint therapy. So it's a very effective way for us to produce, different style splints in-house. One of the really nice parts of splint design is the 3D articulation, like what you just saw a moment ago. And there's newer systems, different systems that allow us to record the patient's actual jaw movement. But what you'll see here is that once we've put forth the design that's most appropriate, we can actually use a virtual articulator with generic settings, or we could even use a patient's pre-recorded motion with an intraoral scanner to help us design a restoration of bite splint that should be therapeutic, maybe hopefully to reinsert protective elements that were worn away, and to use that, more effectively than just creating a simple suck down that might have further adjustment to it. So splints have been very, very successful for us, and they are truly a very profitable part of our practice. Most patients will benefit from a bite splint. Most patients will appreciate the benefit that they feel once they're able to wear a bite splint, and also the ability for us to optimize the design and to make sure that it's going to be, as unobtrusive and more streamlined in the mouth is also another beneficial part to the manufacturing. So very similar to like what you saw before, once the design is complete, that then gets brought into the 3D printing software preform. We add the sprues to it, and then we send it off to the printer. We often print multiple ones at one time because we have multiples that we're producing. And what I really like about that as well is that we have patients, and I would have never guessed this beforehand, but we have patients who actually ask us if they can have multiple ones made. They have, an apartment in the city, or they know that they have a tendency of losing them, and they also know the benefit of wearing it. If they don't have a bite splint, that their jaw becomes almost immediately very, uncomfortable. They grind over their sleep. So we have the ability of easily producing multiple sets for a patient as well. And like I said, I never guessed it, but in the past year, I guess since COVID, and we've seen a lot more patients who are suffering from bruxism and grinding, we've actually recommended them. We say, we can produce more than one. You could have a backup one, and they love that idea. For us, it's as simple as hitting, Control C and Control V and being able to print a duplicate very, very effectively and easily. So splints are a tremendous benefit, and really, a great way to increase production in the office and to pay for a lot of these systems because, we do so many of them. When we talk about these three different parts, we're talking about models, surgical guides, and splints. The key thing to understand is when you actually begin printing in the office, most of the workflows in order to produce in the office are very, very similar. When the print is complete, that is then going to go into a workflow. And let's talk a little bit about, what are some of the simple ways to get started with this in the clinical setting. Because I really think that that's probably the most valuable parts. What I've learned over the past 6 years of printing with Formlabs, let me show you some of the things that I think are beneficial and just how I've set it up so that it makes it easier for us. And if you're looking to bring printing into the practice, these are some of the things that you should ask yourself, where and how are we going to set this one up for complete success? So again, with the solution, we talk about Formlabs, it's not just the printer, right? It's the printer, it's also the post-processing, and it's the materials, right? So, when we look at this image here, this is my setup. And I built this shelf, later on after I said, we need to kind of better set up the system for how we print. Well, first thing is we have our materials that we keep, that you see highlighted in blue here. We have different tanks that goes inside the printer, and then the material gets loaded in the back of the printer. So we keep that relatively in this area right next to the printer, so it's easy to swap out the materials. Now, once a print is complete, then the next thing that's going to happen is we're going to take that build tray off, and then we need to put it into the alcohol baths. And you'll see here we have 3 different alcohol baths. We have the dirtiest, dirtier, and then I guess the cleaner of the 3. And so what we'll normally do is we'll take them off the build tray. That's the part of the printer that I actually print on. We'll take the restorations off, whether it's a model, a splint, or a guide, and we'll put it directly into the dirty alcohol bath. From there, we'll move to the next one, and then we'll move to the final one you see on the right, which is the really nice Formlabs automated alcohol bath wash. So that has an agitator in it. There's a little a little metal bin that will actually raise out of the unit, and it automates the process of doing the final rinse. And by keeping the alcohol in this orientation, dirtiest, dirtier to the cleanest, it then also means that we don't go through as much alcohol, IPA, isopropyl alcohol, to clean the restorations. And by the time it comes out of that last bath, it should be the cleanest. It shouldn't have a very sticky nature to it. Also, that's set up on a timer. So after 10 minutes of rinsing it, it then raises that tray with the whatever you have inside it out of the alcohol and allows it to air dry. And what I found is everything to the right of the printer here is I call our dirty environment. That's where we're going to have, more resin. We're going to have other areas and rubbing alcohol. We're going to be wearing gloves. So once after we've post-processed or we've post-cleaned it, then it's going to move from this area over to the curing box. And the curing box has 2 settings for it. How long it's going to cure with the light, how long is it going to expose it, and also what temperature it should raise inside there. And most of the time we'll cure the materials to 60 degrees Celsius, given to us by Formlabs as the manufacturer. And so whenever we take a print off the model, we'll also start that cure bath, the light oven, so that it begins preheating and gets warm. And it just saves a little bit of time going from the bath once it's done being rinsed and it's dry over into the cure box. The cure box is already warm and it's ready to go. So it's important to know that you're always going to be post-processing the materials. It's important to know that workflow is pretty systematic. It's very, very regular to do with different materials in the same process: clean, and then cure. Cure settings change for the different materials. And another thing that's really important is keep paper towels and rubbing alcohol in a spray bottle close by. What I've learned is that when we didn't have the simplest tools to keep the area clean, we found that the printers themselves would become more dirty. And when the printer would become dirty, you may have a smudge of resin that was on your glove, and you pick up a tank, you don't realize it, and now you've transferred a little bit of resin to an area that may affect how the photo cures. the photo curing happens. So the simplest thing, which saved us so much time and effort in producing good results, is to just have paper towels and a rubbing alcohol container close by, so it's very easy to keep things clean. The cleaner you keep them, the more predictable all the results come with it. So, those have been most of the simple ways that we started. Certainly with Splints, digital 2 setup, surgical guides, digital dentures is a whole other topic that I can talk for hours on top of. Really, really great workflows. But these are some of the simplest things to bring into the office. And consider where you want to fit within that IPO dentistry timeline. Do I want to just do intraoral scanning and then leave the design and the manufacturing as traditional workflows with laboratories? 100%. Do I want to leverage the benefit of digital transfer of information and capture the data, share the data in real time, have a design done, have that come back to the printer immediately, print that restoration in-house, and then deliver it to my patient? So you're not necessarily doing the design, you're outsourcing the design, but you're now doing the manufacturing in-house. And where you want to fit within that timeline is an important question for you to ask yourself, and where it will fit into your practice. And I don't think that you need to begin with all three. I think you should begin and work up to it, to where you want to go. And certainly one of the most important tools into completing the entire workflow of digital dentistry within the office comes down to, how can you output what you have on the screen? How can we produce that in hand? How can we use that to benefit our patients and the treatment that we provide the patients? And that really comes down with 3D printing. So these are some of the simple ways. Again, I want to thank Formlabs for really putting together what I do believe is the best overall platform for us to be able to not have to worry about connecting all the dots to actually be able to print and produce so many different types of indications in the office. And that platform really is the key to having success. So, again, I want to thank Formlabs and Henry Schein, because I think they are our biggest partners in allowing us to do this in our practice. And I thank you all very much. And if there are any questions, I would love to be able to share with you and answer anything.
All right. Thank you, Dr. Jurim. Let's see here. We've got a couple minutes left, so if anyone does have questions, please feel free to drop them in the chat or Q&A. First question here is, approximately what is the cost to make a digital model for a new patient?
So a digital model, now that can vary greatly. And the reason why I say that is, what we realized when we first started printing models is we were about $8 a model. And we were able to bring that down tremendously just by not printing as much. And what I mean is, we are printing all of our models solid. And if you print solid models, they're going to have a lot more material resin in there, and you pay for the resin. Think of it, in milliliters. So, typically now we have the cost of models that can be under $3 a model for the resin. And with the newer resins that Formlab is constantly developing, not only is the printing cheaper, but we're also able to print much faster, which is also a real great benefit. But figure, we're in about the ballpark of around $3.
Do you charge the patient for scanning?
Do we charge the patient for scanning? Typically, no, we don't. There are some patients who come to us solely for scanning, through some other services that are being provided outside. But normally we don't charge a patient when we do. We scan every patient every time. We do have a very standardized process on how, for our new patient visits, to scan every patient every time, on how that process goes down. But we don't specifically charge the patient to be scanned. That's a benefit to us. No matter what, we want to scan that patient because we want to have that digital information available to us.
All right, we've got a two-part question here. We'll go part one first. How are you transferring the STL and DICOM files from the 3Shape and CBCT to the Formlab software?
So we're not. What we are doing is 3Shape is being used as the process part, the design part in the surgical guide design. Now, there's different softwares that could be used to produce your surgical guides. What we use in our office is 3Shape's Implant Studio. There's other software that's available to you. And almost every software that's available now in a clinical setting or laboratory setting allows for you to create that STL file that you are then going to send to the printer. That STL file normally is of the actual surgical guide. So depending on which platform you want to use to do the design, it's really the output of the design that you then send over to the printer.
And then part two, besides the Splint Studio and Formlabs software, are there any other software programs you recommend?
So, the Splint Studio software and the Formlabs software are really, the design and then the outputting software, right? That's what we use for that. Other software that's very valuable and important is the software that we use to actually scan the patient and digitize the patient. And what I can say with that is your ability to scan the patient and the ability to take different scans over time and align them really becomes one of the most important aspects of that other part of digital dentistry, which is, inputting the information. So whichever system you're using to scan with is the other most important part of the software. And that, comes down to, preference. Any scanner you buy is going to come with software to scan with. So I suggest you try different scanners and you see which ones, work for you the best, but you don't have to have a specific scanner in order to use any of the workflows that I shared with you today. You don't have to have a certain scanner. Everything is an open workflow these days.
What software do you use for your smile design?
For my smile design, I use two different softwares. I use 3Shape Smile Design, which is built into our Trio scanner. I use that because it's the most time efficient for us, which is tremendously valuable. We had 3 sisters come in, and each one of them wanted a smile design to be done. Well, 2 of them wanted one. One of the sisters was just there visiting with her other sister. And then she goes, "This is so incredible. I think I want to have, my smile done." So 3Shape Smile Designer allows us to create a 2D simulation for the patients very, very quickly. It gets stored in our digital patient library. And then we can use that to help influence the 3D design, which we then will print and then do a mock-up for the patient. So we always explain to the patients at their new patient intake, we will do a 2D smile design for them at that time, because it's quick and simple, in order to then take it to the next step, which is, let's see if this is something we can realistically do for you, where we have to build in form and function into the 3D design. The patient will then pay for us to do the digital 2 setup and for us to then print that. But those that's the most important software that we use for the smile design process. But again, everything can be mix and match. You can use DSD software. You can use, a lot of different applications to create a 2 and 3D smile design.
And does the 3Shape Smile Design software come with the scanner, or is that a separate purchase?
I believe they did release a version of the scanner now that does not have the software, those add-on softwares as part of it, in order to try to keep the entry level into the scanner as low as possible. So it's almost like, you can buy a car with everything under the hood, but some of the bells and whistles may be off. And later on, if you decide to, that you can add those ones on. So in most of the systems that you may get a quote for from Henry Schein, they'll include that, which they should. But sometimes if you're cost conscious, they can remove it so that there's more competitive options out there.
All right, going to put you on the spot here. Do you know how much the Formlab printer costs?
The Formlab printer, so the printer itself is, approximately it's between $5,000 to $6,000. I don't want to be put on the spot, but it's around there. Your entry into it might be a little bit more in the beginning, because you also have to invest in the curing unit, and you don't need the alcohol bath, but you really should have it. It's in the grand scheme of things, it's peanuts, because it's going to increase your productivity so much that it'd be silly not to get the cure bath and then the other unit as well. There's printers that, and this is important to know, is when we first started printing in the laboratory, we had costs of over somewhat $1,000 to get into 3D printing. And then we still had a lot of limitations. If that printer went down, all of our eggs were in that one basket. What's so great with the Formlabs solutions is that we actually have 3 different Formlabs printers now. So we can, if one of the printers goes down or needs to be serviced, we have the other ones for redundancy. So, the costs have gone down so much to enter into this, into this field. And because of that, we can also have more redundancy, with the system. So we were about there, but I would say you'd probably be around 8 to 9 by the time you add in all the initial things that you need. And then later on, when you're looking to upgrade or you're looking to add another printer on, it's less because you already have the curing, unit, you already have the wash. So you don't normally have to reinvest in those.
All right. So you're telling me if I like peanuts that I should buy a Formlabs printer.
I'm saying that in my mind, it's like a no-brainer. You should have had one a year ago because it's going to allow you to do so many more things. And then when you look at the grand scheme of the investment within the system, you'll get so many more benefits out than what the cost involves you to put in.
I like it. Good answer. All right. I think we got one more question here. How are you storing all of the data from your scans?
Oh, that's a great question. That's a whole other webinar that we can talk about for forever and ever and ever. But there's no specific technique that I use to store the data from one individual system. I use a lot of different systems. We have 3Shape, scanning system. We have other design software. We have photos. We have 3D X-rays. We have a ton of data, and all that data needs to be secure. It needs to be redundant. It needs to be accessible. It needs to be secure. So fundamentally, what you need to do is you need to back that data up on site. You need to have that replicate offsite in case of tragedy, something like your office burning down or a flood. And the good news is that I've been doing digital dentistry for as long as I can. Remember, I started dentistry in 2010, and all the data that I've acquired now, is really not that much. I would say it's under 2 terabytes of data. And you compare that to, a bunch of movies on an external hard drive, it's not that much. So it's manageable for us. It's just making sure that you have a good, with your IT team, you have a good disaster recovery plan always put in place. Because we got hit with a ransomware attack last year where all of our data was encrypted by some foreign individuals. And yeah, that's not fun. So you just have to make sure that, any way you manage your data, that you have a good system to do that. I suggest that you back it up on site and that replicates off site as well. And that you have a qualified team with a good disaster recovery plan put in place. And then after that, the first question that team's going to ask you is how much data, because they're thinking already, I know this from the school where I teach at, they're thinking about tremendous amounts of data, but in the grand scheme of things, it's really not that much. So I would say that, you can easily manage it with the right IT team.
All right. Well, there you have it. If anyone has additional questions about the Formlabs 3D printers or adding them to your practice, please feel free to email us at webinars@henryschein.com, and we'll be happy to connect you with a sales rep in your area. As a thank you for attending, everyone will receive the recording of this webinar via email sometime in the next week. Thank you, as always, to Dr. Jurim for the great presentation. Thank you to Formlabs for sponsoring this webinar. And of course, thanks to all of our attendees for joining us tonight. I think that's it. So have a great night, everyone.
All right, everybody. Take care.
Thank you.